Of course, extending the discussion on tackling COVID-19 with federal government regulations and procurement of vaccines in Nigeria, I have with me the senior lecturer at University of Benin, and also Deputy Director, Central Research Laboratory in the University of Benin. He is Dr. Godwin Igaro. Thanks for coming, Dr. Godwin.
Nice to be here.
Right. Well, we're all in the pandemic, and it seems not to be leaving us. But we have this whole aspect about arrival of the vaccines. Why some are having some kind of feelings, differences about embracing the vaccine. We keep seeing in reports where people say, if the vaccine should be used in Nigeria, the government officials should take it first. What's your perception about this vaccine that we may be getting anytime soon?
Okay, thank you. Well, as for vaccine, it's not today that we have become used to vaccine or vaccination. In other ailments or sicknesses that have been in our world, there have been acceptance or high acceptability for vaccines. We have had vaccines for TB, yellow fever, and all that. So for children, we take our children for vaccination. So the fact that COVID vaccine has come, we should also remember that if science made it possible for other diseases to be prevented, preventive medicine with respect to vaccination, immunization, and we have accepted it, and we have taken our children for vaccinations, and we ourselves have taken certain forms of vaccine in the past, we should also base our judgment on the reliability of previous vaccines or vaccination exercises. So based on the past and our previous advantages that we have taken from vaccination, we should also use that to extrapolate to this COVID-19 vaccine.
But don't you agree? Okay.
However,
okay.
You know, there is this in vaccine production, there are medical, pharmaceutical procedures that should be followed with respect to long duration of research and clinical trial of the vaccine. But the way COVID-19 has come, it has not given us a long time and opportunity to, giving the world, the scientific community, a long time opportunity to do, develop the vaccine and have long duration to do trials,
yes,
so that you can see the risk and the benefit.
Okay.
So in every vaccine development and use, there is this analysis we call risk-benefit analysis. So we are supposed to have had proper research, long-term research, using cohorts of people to get out to the risk and the benefit. Okay. But at this point in time, this is a pandemic, and a number of people are dying all over the world. So there is a little shift where you will look at benefit and play down on risk a little bit.
Okay.
So the risk of taking an untried vaccine or a vaccine with no massive data of side effects,
yes,
you have two options now. You want to have massive data, emerging data of side effects and benefit. And another case, you have a number of people dying. So at times you look at benefit of saving those that are dying, and you play down on the risk
yeah,
of the risk that may be gotten from taking the vaccine.
Okay.
So the risk may be less in weight than the frequent death taking place all over the world. So let us face the risk, which is less in gravity, okay, and avoid death. So in that regard, we could take a vaccine that have not had long history of
okay,
clinical trials.
You made mention of risk, and my mind is playing on this issue about the African mindset. Don't forget, this is Africa. And there's this theory, there's this impression that this vaccine could be targeted on the African population, yes, to reduce the African population. And so some Africans, some Nigerians are skeptical about taking this vaccine because they don't know what it may do, or they don't know if it has a chip in it that the white man maybe could be using to monitor the black race. All of this impression, how do you think we can handle it as Africans?
Okay, I'm a toxicologist by training, I'm a medical lab scientist by first training, toxicology by specialization. In toxicology, we say every substance is a poison. Nothing is without a poison in itself. It is dose alone that makes it poison. In other words, water can become poisonous if you take it to a volume that is excessively bad for your state of health.
Okay.
Oxygen,
too much of everything is bad.
Yes, that is a simple context. Now, we have 3 candidates vaccines in the world right now. We have the Moderna from the US, Pfizer is there, and we have the Oxford AstraZeneca, which is from the UK. Now, these vaccines, were they first produced and shipped to Africa freely to say, just take it and save yourself? After we have seen the side effect in you, we will come back and take it by ourselves. No, the vaccines were developed by the developed world, and they have started taking it. So it will be difficult for you to substantiate that opinion. Okay, but I say that it's for destruction or to reduce fecundity, fertility, and population in Africa.
Okay, but you made mention of reaction, as in the risk factor.
Yes,
you know that there's no much time to really study this to see the risk factor, but because of the emergencies that we have in our hands, made it mandatory for these vaccines to be rolled out, while placing less emphasis on the risk factor. But again, don't you think Nigeria or Africa happens not to be the worst hit as pertaining to other clients,
of course.
You know, and so there has been this idea that we should have our vaccines, our homemade vaccines, Nigeria-made vaccines, rather than depending on from the one coming from the developed world. What's your argument in this?
Okay, first and foremost, we should know that there's an established anti-vaccine lobbies all over the world. Anti-vaccine lobbies. That is agencies, organizations, group of people lobbying against the use of vaccine for reasons best known to them. So even if a vaccine becomes 100% beneficial and effective, somebody may go ahead and lobby against the use of that vaccine. So at the end of the day, in that case, you should know that there should be a distraction or a disturbance to the use and acceptability of vaccine. That's on the one hand. But one thing we should know in terms of Africa developing a homemade vaccine. Now, desires are different from developments.
Okay.
Potential and capacity are different from aspirations. Assertions on media platforms are different from readiness. Prior to this time, you heard me say Oxford AstraZeneca vaccine. That is a collaboration between the University of Oxford, UK, and a pharmaceutical giant collaborating in research to bring about development of vaccine. A situation where ASU, for example, will go on strike for 24 months, 12 months, and politics about the issue of university upgrade development will be very high, and experts in politics will be controlling educational and research institutions. How do you think that a university system, a research system, or research institution that have not had salary paid to their staff, or that have not had good laboratory 10 years ago, 20 years ago, we just wake up today and say, because there's COVID-19, within 15 months, let us develop a vaccine? When you have not ab initio prepared your capacity, human resources, in terms of intellectual enterprise. So
that's like putting the cart before the horse.
Yes. So that those people can vaccine for locally made vaccine should know that there are hints. It's a good dream. It's a good vision. Where if that's the dream we are starting from, thinking about it is a good thing. Thought can be the first stage of any process. But we should know that before now, we have not developed capacity in our research institution. It's not a wait and see issue. We may have wait and see government by way of give contract out. Vaccine production is not a way of political contract to do this, construct this through. There must have been a capacity developed somewhere in terms of human resources, materials, technology, in our schools, in our research institution, that will make us rise up to certain challenges, like as of today. And for your information, there are many countries that are well far developed than Nigeria in terms of science and technology. They have not been able to produce vaccines. So that Nigeria is not doing that now does not make us too bad. But that we will never think of doing it at all by enriching our educational and research capacity. That will be where the battle will be.
Let's look in the direction of what the co-founder of Bill and Melinda Foundation, Bill Gates, said about the federal government under President Muhammadu Buhari, that their president should prioritize improving the health sector over vaccine purchase, vaccine procurement.
Yes.
In terms of priority, what do you think of that statement by Bill Gates?
Well, in responding to emergency of increased mortality due to COVID-19, I think the federal government is very right to think about bringing vaccines.
To prioritize vaccine.
Yes, to prioritize vaccine, because at this point, it will be a strategy.
Overspending more in improving the health care or health sector. Because they go together.
Procurement of vaccine is a healthcare policy response. It's a healthcare policy. They are all blended together. For example, you are talking about vaccine. When you bring the vaccine, are they not going to be administered?
Okay, but if you have a health sector that is diminishing or that is deteriorating,
yes,
and you are procuring vaccine,
yes,
without placing much emphasis on improving on the deteriorating health sector,
yes,
don't you think that's like shooting your feet?
Yeah, that's why I say they are together. They can concurrently happen. Okay. Nigeria has the capacity to make it concurrently happen simultaneously, like a simultaneous equation. Now, at this point in time, you need certain responses in the healthcare facility of Nigeria with respect to vaccine handling, cold chain storage. There's a logistics for vaccine handling, logistics for vaccine delivery. So at this point in time, Bill Gates may be right in one way, but he cannot use his statement to direct our step. We, by our rationality and by knowing the emergency state of COVID-19 in Nigeria, if our data are the right data, we are not politicizing the COVID-19 data. If we have the right data, reliable data, we should be able to procure the vaccine as a priority. Then put facility in place in terms of our teaching hospitals, our medical centers, to maintain the vaccine in good conditions and also store the vaccine as well as deliver the vaccine. So in all of these things, there could be an emergency health policy or health care strategy that we bring about proper storage, proper delivery, as well as procurement. So we do everything together, because we cannot say let us just buy. That's commerce. Buying is commerce. But bringing it together, storing them well and delivering them in valid conditions is healthcare technology. All of this can come together.
Okay. Well, in case you're just joining us as TMI Tuesday, and I've been having a chat with the Deputy Director, Central Research Lab, University of Benin. He is a senior lecturer, Dr. Godwin Igaro. But let's look at this paradox that the COVID-19 seems to present, in the sense that it comes with controversies. Why the virus is killing some people with much efficiency, others are affected even without knowing it. Now, this makes some people to believe that, or to have this impression that it is a hoax. So what do you make of this, and how can we manage it in Nigeria?
Now, first and foremost, we all have seen and we have agreed that the mortality rate for this virus is higher in the Western world than in Africa.
Of course, yes.
So partly because of issues of travel, Western world traveling, the world is more knitted together in terms of movement here and there, and also partly because of environment, temperature condition, and perhaps genetics, which you cannot fully substantiate right now. Then, of course, then we cannot expect the same level of international traffic, travel traffic between US and Nigeria. The number of people that visit the US every year is far more than the number of people that visit Nigeria or Africa and all that. So those are indices that can propel disease transmission,
or a spike. Okay.
Disease transmission and all that.
Okay.
Then in terms of disease vulnerability, lifestyle, genetic predisposition, all of these are important underlying factors that affect disease vulnerability.
Okay.
So, but now we come home in Nigeria. You see, some people contract this illness, and we have had mortalities from this illness. While some people contract this illness, they will recover.
Yeah.
Some people contract the illness and don't even know.
Don't know it.
And some people have not even contracted the illness. So you have, like I said, 4 categories of persons: those that have contracted illness and they died, those that contracted and recovered, those that
those are contracted that got sick and recovered.
And they got sick and recovered. Those that contracted and never got sick and they recovered. And those that never contracted. So all of these could be based on a number of factors. One, before the illness came to the person, for example, before contracting the illness, what was the immune status of the person? What was the immune status of the person? So people have high immunity based on what they eat, genetic makeup of such a person.
Okay, so that's some of the differences we have.
Yes, of course. Okay. Someone that has underlying ailment could contract the illness. That underlying ailment may have undermined or caused immune suppression or immunocompromised condition. The immunity may be compromised or suppressed by underlying illness. When the person contracts such virus or the COVID-19 virus, and the pathology of the virus can take advantage of the immune status.
Okay.
Then, of course, we now come to some persons that had it and they recovered. They responded to treatment on time, perhaps because they had access to treatment. They were connected to have access to the state doctor or whatever they are using. While some that died, they did not have access to the treatment on time. They could not have been in a socioeconomic status of the society where attention will be given to them. Now, this issue of response to someone that has COVID-19 in Nigeria, personal observation have shown that certain persons may contract it, and at the end of the day, may be to an extent neglected, and the person can get serious with the illness and die. While some other person have first line priority to be treated, and the person will get well. Okay. So it depends on finances, connection, socioeconomic status. These are personal observations anyway.
Yeah.
So that's it.
Thank you. We look forward to having more testing, because what you just said also dwells on not being tested the way we should be. The testing capacity in Nigeria is quite low. And with the research, with the laboratories, don't you think that there should be a drive in this direction where researchers, laboratories can also help in testing people?
Well, yeah. They know there's a
You have 1 minute on that.
There's a protocol as per testing in Nigeria. Okay. The Presidential Task Force has a protocol under the Federal Ministry of Federal Ministry of Health. That protocol must be followed. Yeah. You cannot just wake up as a private hospital in Nigeria or as a private laboratory and design a template for testing COVID-19. Okay. You must subscribe to the protocol of the government, because it's a pandemic and government reserve the right to determine the way we should go about it. Okay. But what we are using for testing today are primarily imported. Okay. And the control of the imported items.
Primarily imported, but there are some that are also designed within the country.
No, they are
okay.
They're all
imported.
Like
or converted. Some are being converted.
No, they are imported as per the PCRO used. The primers that you use. Those are high-tech materials, okay. And they need to be stored and properly handled. Okay. A private hospital that cannot guarantee sustained electricity, or a private laboratory diagnosis center that cannot guarantee sustained electricity, okay. Sustained storage conditions for their reagents, okay. Will not be able to acquire those things and store them well and keep them in valid conditions for testing. Okay. So that's why we subscribe to the federal government testing platforms.
Okay, thank you so much.
Facility.
Thank you so much for taking our time to be part of this show, Dr. Godwin Igaro.